Hey everybody, my name is Samantha Hood and I'm currently a family nurse practitioner student at the University of Memphis in my last semester, and today this assignment is going to be a video presentation regarding safe practice strategies and legal risk reduction techniques as we transition from the role of student to provider. So I have my notes behind me as a reference, but we're going to go ahead and jump in. So first we're going to talk about scope of practice and regulatory overview. So my scope of practice, I live in the state of Mississippi, and that's where I practice currently as a RN, and our scope of practice is reduced. So for me as a new APRN transition to practice, some rules that they have in place in Mississippi are: if you are a new grad RPN, an APRN in Mississippi with less than a year experience as a registered nurse, you must have 2,000 hours of monitored practice hours. On the other hand, and this is where I fall into this category, if you are a new grad APRN in Mississippi with greater than a year of practice as a registered nurse, you must complete 1,000 hours of monitored practice hours. And you also must have a collaborative consultative relationship with a licensed physician whose practice is compatible with that of the nurse practitioner. Some telehealth considerations in Mississippi: health insurance and employee benefit plans must cover telemedicine visits the same way that they cover in-person visits, which can be really helpful for our patients in rural Mississippi who may lack accessibility of care in many different areas. And then patients generally need an established provider-patient relationship prior to having an audio-only telehealth visit. Next, we're going to jump into the 7 C's of malpractice prevention. So we have care, communication, consent, competence, charting, confidentiality, and consultation. So I'm hit some high points on each one and then go into tips of how we can apply these to our practice daily to reduce risk. So care, we want to ensure standard of care and nursing is in place. We want timely follow-ups, and we want to pay attention to our patients, listen to them and their concerns. Communication, we want to make sure there's clear communication between providers and patients to reduce error, to promote understanding, and to make the patients overall more satisfied. Consent, we want to ensure our patients understand their diagnosis, their treatments, their procedures, and all the risks and benefits involved so they can make their decision based off the information that we give them. So it's our job to relay that information well. Competence, on our end as the provider, we need to make sure we are staying up to date on information. Medical world is ever changing, evidence-based practice, everything like that. And then we go into charting. We know as nurses, we have to document. So we need to document well to track the care given, what we have tried before, what works, what doesn't work, and for legal purposes. Confidentiality, again, we know HIPAA, provider responsibility to keep PHI private, which is protected health information, and the patients have the right of privacy and healthcare information, not only legally, but ethically. And then consultation, we need to know when to refer out, when we cannot handle the patient's care on our own anymore, it's out of our scope of practice in our state, and when to seek guidance from specialists. 2 to 3 tips: we want to document, cover our bases like we have court tomorrow, make sure we get consent and utilize teach-back techniques, refer when necessary, and educate our patients on red flags and when to seek emergent care. Next, we're going to move into common liability risks and mitigation. So 4 areas: we have diagnostic errors, medication errors, then we also have lack of informed consent and failure to treat. So hitting high points on each of those. Diagnostic errors are the most common form of medical malpractice. They can lead to delayed treatment and wrong treatment, and about 7.4 million people are misdiagnosed each year. Medication errors can occur during any stage of administering medications. You run the risk of adverse and allergic reactions or even death, and 1.5 million people are harmed from this yearly. Failure to treat neglects to implement the correct treatment for the patient. And then lastly, lack of informed consent. If we aren't giving our patients proper education regarding their diagnosis, their treatments, their procedures, the patients may receive care that they may not want, or their wishes may not be respected. Simple but effective strategies to prevent these risks include limiting distractions when we're prescribing medications and using the 5 rights of medication administration. We want to maintain close follow-ups and rechecks and testing as needed to ensure accurate diagnosis and treatment. And we want to watch for patient improvement. We want to document the plan of care for not only our use, but for the use of other providers and other interdisciplinary team members. And we want to utilize, again, the teach back method, using knowledge the patient will understand and building rapport with our patients. Next, we're going to move into personal transition and risk reduction strategies. So plans as I transition into practice include, again, using my medication administration 5 rights that I learned as a nurse, taking into account the patient as a whole, their history, their allergies, making sure I listen to them, using that thorough documentation each visit to keep track of their treatment plans, what we are trying, what we are currently doing, what we've done in the past, what works, what doesn't work, everything like that, which can get very tricky with chronic patients, but that's why we have to be very thorough and very involved. We need to also consult specialists, especially when I can no longer handle it myself. And again, in Mississippi with the supervision hours, if I'm ever unsure as a new APRN, I can go to that other provider and ask for their help. But it's knowing when to ask for the help. And then also familiarizing myself with my personal malpractice insurance in my state and staying up to date on evidence-based practice, new medications that come out, because they're always coming out, and making sure that I'm well informed to take care of my patients well. So that is the main conclusion of everything. So basically, we just need to continue to document well, to listen to our patients, to practice safely, to refer and seek guidance from specialists in their area, and to just be ready to have lifelong learning as an APRN. The medical world is ever changing, and we need to make sure that we are doing our part as a provider to provide the best care possible for our patients, because we're not, as a nurse, we're their advocate. So we need to make sure that we're doing our part to make sure they are the healthiest and happiest that they can be. So thank you for watching this video, and that's the end.